Welcome everyone who are joining us now. We'll get started in a minute or so. Thank you so much for joining us. In the meantime, please introduce yourself in the chat and tell us where you are dialing in from. We'd love to hear from you. Thanks. Welcome to those that are just joining now. We'll get started very soon, but in the meantime, if you could introduce yourself in the chat, that would be wonderful. Thank you. I think we should get started. So hello to everyone that's joined us so far. Thank you so much for joining us and welcome to this webinar on the Trinity Challenge on antimicrobial resistance. So this session is specifically to answer your questions about your submissions, and we hope by the end of it you'll be fully informed and be able to hit that button. My name is Louise Goff. I'm the Chief Operating Officer for the Trinity Challenge, and it's my pleasure to be joining you today. During this session, I will be joined by colleagues. So I'll be joined by two colleagues from our work, Professor Marc Mendelson, who is the Director of the Trinity Challenge, and Noel Shaskan, who is the lead for the health community at MIT Solve, who are our key delivery partner for this challenge. I'd also like to say a very quick thank you to the team who are making it all run smoothly in the background. So thank you to Hamish Morrow, Charlie Aldwick, and Jenny Smith. So what we're going to do today, we're going to share some key information with you at the start, just to remind you of the parameters of the challenge and why we're doing this challenge. And then what we'll do is we'll move into the main part of the session, which is about answering your questions. Some of those questions have been submitted in advance, so thank you to those of you that have done that. And then you have the opportunity to ask your questions using the Q&A function in Zoom. So please think about starting to use that function and ask your questions, and we'll get to those a bit later. Finally, before we begin, I would like to say a huge thank you to our funders. They are making this challenge possible, and we couldn't do it without them. So a huge thank you to Wellcome, the Patrick J. McGovern Foundation, and the INEOS Oxford Institute, who have given generously to this challenge and continue to support us. You can read more about our growing list of funders on our website. So if you could go to the next slide, please, Hamish, we'll get started. Thank you. So this is a very key slide for everyone to pay attention to. This link is the link to all the information that you need about the challenge and where the application sits. So it's where you will submit your application. Applications are published on the portal, and actually you'll be able to see, very excitingly, some of those applications have already started to go live. There's around 30 on there that you can have a look at now and be inspired about your application. You'll find a huge amount of information on here, all about the different criteria that we apply to this challenge, how things will be judged, what we'll use to make those decisions, and some frequently asked questions, some of which we'll cover today. So let's get started. And first of all, I'd like to hand over to Marc, who is going to tell us some key information about why we're doing this and what to look out for in your applications. Thanks, Marc.
Thanks very much, Louise, and good morning, good afternoon, good evening to colleagues on the call. Thank you from my side as well for joining us. I'm hoping and feel likely that the majority of people on the call will already be well versed in the challenge. But I wanted to really focus on some key issues which have been the source of a number of questions that we've had. I want to reiterate that this Trinity Challenge on antimicrobial resistance is specifically looking at a gap being data from the community level in low and middle income countries across the One Health spectrum. Now, the data needs to be collected from low and middle income countries. We are not focusing at all on data from high income countries. When we talk about community level, we're specifically talking about out of hospital and out of industry data. So we're looking at the community level. And in terms of One Health, your solutions can address human health, animal health, environmental health, two of those or all three. And what we're looking for, and which is part of is the mission and vision of the Trinity Challenge, is to use innovation in new data and analytics to further our understanding of antimicrobial resistance at the community level. And again, when we're talking about antimicrobial resistance, we need to be clear that we are talking about antibiotic resistance in bacteria. Next slide, please. So what sort of development stage level can apply? And again, this is an important question that's been asked a number of times. So really, it's non-prescriptive in the fact that this can be anything from proof of concept, where you have a testing your prototype, your research product or service, business policy model, whatever it is, and you've built preliminary evidence or data for it. That goes all the way through to a pilot phase, to a growth phase, and then scaling up to a potential solution that you have that is able to be scaled significantly, either at a national, regional, or at a global level. Next slide, please. So who can apply? We're looking for applications from pretty much anyone in general. It could be from universities, it could be from academia, it can be from non-governmental organizations. You can be from for-profit organizations, as long as you don't meet two or more of the criteria which are asterisked, which are on the exclusion side. So if you have a for-profit organization with over £50 million turnover, £20 million in assets, or over 250 staff. We welcome applications from startups, technology firms, and high-income country organizations and PIs can apply, as long as there is bona fide partnerships in low middle income countries, delivery in low middle income countries, and the budget direction needs to flow to low middle income countries. Now, who's excluded? We are excluding government agencies or their foundations. I've talked about the for-profit organizations exclusions, and non-data driven or technology solutions would not be eligible. Next slide, please. How can you use the funding? That, again, specifically, we've had a number of questions about direct and indirect costs, true overhead costs. This slide speaks to this. So you can use for direct costs that are only arising from delivering this specific solution. And so the examples you can read on the screen, anything from staff salaries through to supplies, legal insurance, etc. The real indirect costs, those costs that only arise from delivering the solution, which are shared with other projects that you may have at the moment. Those could be anything from a finance manager to accounting analysts, etc. And then true overhead costs. And importantly, and I know that there are a number of organizations and academia, universities in a number of countries where the percentage of the budget is usually given far higher percentages to true overhead costs. But from an organizational costs existing regardless of the solution, but the maximum needs to be 10% of the budget. And these may be departmental costs, board governance costs, etc. Next slide, please. Just to run through the timeline with you again, this was launched, as you know, on the 14th of November. The application deadline is 1700 GMT, Greenwich Mean Time, on the 29th of February. The shortlisting will then take place between March and April, and mid-April we'll be selecting finalists who will then be invited to interviews early in May. And we are having the award, the winners being announced at the award ceremony on the 6th of June. There'll be a contracting period thereafter, and the maximum duration of funding is 3 years. Why apply? Well, this is a significant award. The first prize will be awarded up to £1 million as the grand prize, and there will be secondary prizes, and the number of those will depend on the final prize fund pool. Another reason to apply, and one of the strong features of the inaugural Trinity Challenge, and we're hoping this one as well, will be mentoring support. We have a very amazing set of partners who are both funding but also in kind, supporters who are forming a coalition of members into our steering committee, and we'll be looking to try and link up people, winners, in terms of support solutions from a number of our partners. And then there's also the public recognition that this will give, hopefully through our channels and our partners' channels. And this obviously is framed within a very, very significant year for antimicrobial resistance at a global high-level meeting at the United Nations in September. So next slide, please. I'm going to hand it over to Noel Shaskan, and she'll take you through some application tips. Thank you very much.
Hi, everyone. Thank you all so much for being here today. My name is Noel. I'm the Health Community Lead at MIT Solve. As Marc said, I wanted to share some tips for your applications. I've reviewed probably hundreds, if not thousands, of applications for different challenges. And these are some of the tips that I think really set folks up for success in being selected. First off, if you haven't already, take the time to really carefully review the overview, criteria, and FAQ pages, particularly the criteria page, because that will tell you exactly how the judges will be reviewing the applications and what they will be looking for. It may give you some ideas of additional information or data that you might want to put in your application that you hadn't thought of before. I'll also suggest that you communicate key details concisely. We don't need you to write a book. We don't need tons and tons of background information. Really focus on just the key information for your solution. In addition, don't be overly technical. The vast majority of solutions that I've seen be selected are ones that are able to communicate really complex ideas in really simple ways that the average person could understand. As you'll see when you're filling out your application, only some questions are required, but I would encourage you to fill out as many questions as you can. That just gives us a richer understanding of the solution that you're working on. Finally, I really, really, really encourage you, this is a big one, don't wait till the last minute to submit your application. In our platform, you can submit your application and then go back in and edit up until the deadline. So this is not something where you submit and that's it. You can't make changes. Better to submit now and go back and edit so that it's in the platform rather than have issues at the last second and not be able to be considered. So we're very excited to see all of your applications come in, and I think I'll hand it back to Louise.
Thank you so much, Noel. Thanks, Marc. We're seeing lots of questions coming through, so we can get going with answering some of those. Perhaps if I could start with you, Noel, with some more technical questions around the platform itself. So if people are having difficulty with their applications, it's not submitting for any reason, or they're getting any sort of error messages, what should they do in that situation?
Yeah, definitely. So I think the most frequent issue that people will run into is an application not submitting, and that is almost always due to not filling out all of the required questions. So just go back, check that you have filled out those required questions. If you have and you're still having issues, you can always reach out to Solve, help@solve.mit.edu. I'm just dropping that into the chat, and we'll help you sort out any technical difficulties.
That's brilliant. Thanks, Noel. And then I've also got a question for Marc here around, I know you've already covered it, but perhaps if you could just reiterate it again. In terms of what costs can be covered, would we consider covering office costs or rental costs in this programme?
Yes, there are, as said on the original description, there is the ability to budget a certain amount for that. It has to come within the budget constraints that I've outlined, but that is permissible, yes.
Great.
There's a shared costs between this project. If there's shared costs between this project and your other projects, then there is an ability for that to be taken into account in your justification.
Thank you. And if we could stay with you just for now, Marc, could you talk a little bit more about the need to make sure that these solutions are very much from within lower middle income countries, and therefore the balance of the funding that we're expecting to see if a high income country organisation applies? What are we looking for there?
So absolutely, the focus, as said, is on low middle income countries and that major gap, and we want to see that reflected in the solutions that are put forward or the applications put forward, but also meaningfully that there is clear collaboration between, if there is a high income country putting in with low and middle income country or countries, doesn't matter how many, and that the budget does reflect that. Now, we haven't stipulated, we haven't made a benchmark for this in terms of the actual percentage, but we would be looking for the majority of the, well, certainly over half at least, the majority of funding going towards the low middle income country collaborators, if you are applying as from a high income country, as the PI from a high income country.
Thanks, Marc. And if I could ask you another question around community or communities. Obviously, there are lots of different ways of defining that. And there are lots of ways of defining that within One Health and the work that we all do. Could you give us a little bit of guidance about what you mean by that, by communities?
Thanks, and it's a great question. I really appreciate that, because community is not a homogeneous entity, and as you say, a community has many meanings. I think what we're really trying to convey, the most important thing we're trying to convey, is that this challenge is not about innovation and data within hospitals. Okay, we have there is a fair amount, obviously not enough in low middle income countries, but we are not focused on hospital level data. So we're not interested in stewardship programs in hospitals. We're not interested in the data that's coming out of hospital laboratories around hospitalized patients. Similarly, this isn't about data specifically from big industry. So when we're talking about community, what are we talking about? Well, in human health, we're talking about at the primary, potentially at the primary care level, community health workers as an example. In terms of animal health, we're looking at the sort of farming level, the food production level. And then in the environment, again, what are the areas potentially in the environment? We know that wastewater was a major issue in COVID-19 to allow us to better surveillance. Is that true for AMR? Is it some other? Is it farm slurries? Whatever it is. So, but it's at that level. And just remember that the other issue about this challenge is what we're also very excited about and interested in is how new or existing data sets could be integrated with citizen-related data, be that either health metrics or things like climate, mobility, to give us a better understanding of maybe transmission pathways within the community, for example, access pathways within the community level. Where do people access their antibiotics at a community level? So I hope that gives a flavor. There are, on our website, there is a link to some overarching questions that are there as a menu of opportunities. They do suggest other areas within the sort of community setting, and I would have a look at that if you have any further queries.
Thank you. And if I could just ask one more specific question that's come through on types of information or data that could be looked at, would we consider outpatient data?
Well, those are outpatient data that is hospital level health institution data. So we're not really looking at outpatient data because those patients have often been in hospital. They have chronic diseases that require hospital follow-up. So outpatient data, I think it would have to be a case-by-case basis. If there was a very, very compelling argument, if it was part of the application, but data that are situated within hospital outpatients is not be what we're looking for.
Thanks, Mark. Perhaps if I could bring Noel in for a couple of more technical questions around the portal and the application. There's a few questions around what people should provide in terms of their links, so videos, URLs, and things like that. Could you talk us through that section of the application, what we're looking for there?
Yeah. Absolutely. So there are specific questions where you can upload, for example, a video with an overview of your solution. The format for that video would be a link to a YouTube video or a Vimeo link. If you're not able to use those platforms, that's totally fine. You can also drop in another relevant section of the application a link to, let's say, a Dropbox or other cloud storage where we're able to view that video. It just may not embed and show up the same way in the application. And Louise, I know I've seen a couple questions come in about other links. If you want to share that information, that's absolutely fine. Please feel free to include additional links. I do encourage you as much as possible to type up the most critical information in responses in your application. Don't rely too much on additional links that will bring us out of that application. If there's something really important or supporting information, references, things like that, absolutely drop those links in. That's no problem. But
that's great. Yeah, thank you. Good advice. And then another question's come through around the budget and how that is presented. So if I'm right, there'll be an initial application of an explanation of how much money is needed and how it will be spread out over time. But the next stage, once people have been shortlisted, they will be asked to provide much more detail on their budget. Is that correct?
Correct. So the current application has a pretty open-ended question about your budget for the next 3 years. This is fairly high level. We just want to get a sense for how you would be allocating budget. If you are selected as a finalist and make it to the next stage, that's when we would ask for much more detailed information and give a template.
Great, thank you. And there's a couple of questions here around who wants to apply. So there's lots of enthusiasm about joining in. And one question is around there's more team members than the application portal allows. What would you recommend in that situation?
Yes. So I assume that the person asking the question is referring to where you can sort of upload different profiles for members of your team. I believe there is a limit on that, so that makes sense. What I would recommend is focus on uploading those profiles only for the really key members of your team. I know that some teams may be very large. If you do want to acknowledge all of the different members and there isn't enough space, there should also be some open-ended questions within the application that are asking about your team and your organization. You can absolutely feel free to list out members of your team and short descriptions of their contribution there.
Great, thank you. And also for you, Noel, please, if that's okay, could you talk us through what the judges will be looking for I think if we can talk that through, it will answer some of the questions that have come in around, are we looking for a particular type of product or a particular type of solution, or can it be research orientated, or does it have to be a practical tool or app or something like that?
Definitely. So maybe Charlie, you can also drop a couple links in as I'm talking through this. This is where it's going to be really, really helpful to take a look at the website because first of all, the judges are going to be looking for alignment. And when we say alignment, we're thinking, okay, how well does this solution address the question and the problems that are stated in the overview of the challenge. So be sure to read that overview very carefully. In addition to the alignment criteria, we're also looking for a number of other things. For example, impact. So is this going to have the potential to positively impact many lives? Feasibility. Is it a feasible way to address the challenge, as well as a number of other criteria. And actually, maybe Hamish, I think you had some of those up on the slides if you wanted to bring that back up. But all of those criteria are very clearly listed on the challenge page. So I would definitely encourage you to go through them and make sure that your application in some way, shape, or form addresses those different elements.
Great. Thank you.
I think I'd just perhaps, Louise, if I can just add, I mean, that's absolutely, totally agree. But the other thing is, innovation. We're looking for innovation in the data and analytics. And now the innovation in data may be existing data sets, but that are used innovatively in a different way. And the analytics may be existing, but used in an innovative way. So, we do expect that there are perhaps some people working completely outside the field of antimicrobial resistance who have fantastic, ability, fantastic solutions potentially that could be actually put into the antimicrobial resistance field. And so, that's also important. It's about innovation. We're looking for innovative solutions.
Yeah, thanks, Mark. And what I'd just like to say at this stage, we're having some really interesting questions come through around your individual ideas. It's going to be very difficult for us to comment on each of the individual ideas that come through. They're quite specific, but we hope that the questions that we're going to be answering now will help you work out whether they're viable or not. The next question for you, Mark, could you talk us through what we're expecting in terms of the grand prize, and will there be other smaller prizes awarded?
As said, the grand prize is up to £1 million sterling. There will be other prizes awarded, and the exact amount of that, the amount of each prize will, as said in my introductory slides, will depend on the final prize fund pool. But we are in a position to tell you that there will be other prizes being awarded. But the grand prize, the first prize, is up to £1 million.
Thanks, Mark. And we've had another question around volume of applications. And although it's too early for us to say at this stage, would you be able to say something a bit about what we're expecting in terms of volume of applications?
Well, I think as Noel mentioned, the website currently has posted about 30 full applications that have been posted. We have a number in draft. We can't say how many we're going to be getting. We're very delighted by the sort of volume of applications that are in draft. We would expect somewhere, I think, between 100 and 200 final applications, but we may have many more than that. So we'll just have to wait and see. But we're really, that means that, that there's a healthy competition, which is fantastic. That's what, we want. But you sitting listening to this call may have the fantastic solution that we're looking for. So I think, go for it. We're really interested to hear and see your applications in full.
Thanks, Mark. And just to lead on from that, we've got a couple of questions about who can apply. So we've got one question that says, can an individual apply for this challenge? And that the
No,
answer is
unfortunately,
no.
yeah, the exclusion criteria, if you on the website, shows that if you're under 18 or you're an individual, you can't apply for the challenge, I'm afraid.
Yeah, that's correct. But what if there are so many amazing ideas, it's hard for an organisation to choose which one to put forward? Can an organisation put in more than one application?
Well, again, the term organization means many things to many people. But I mean, when we're generally talking about an organization, you may be talking about in academia, different universities. You may be talking about different organizations, foundations. The answer is yes, but we really counsel you that you cannot be a PI, the PI on two applications. You're not going to be funded twice on this challenge. So if it's about having a lot of great ideas, which could be consolidated into one application, I think that's your gold standard. But certainly if University A or University B have more than one applicant with, who are different PIs, that is perfectly okay.
Great, thanks, Mark. And another question around eligibility and things to consider when applying. What if an organisation has a judge on this challenge within it? Can you still apply?
The answer is yes, you can. I mean, obviously, as in all applications and grant-giving bodies, that would be taken into account, and that judge would be recused from viewing or having anything to do with your application. But yes, that is allowed for in the rules of the challenge.
Great, thank you. I'm seeing a few questions coming through on communication projects. So would communication projects in the community, for example, with young people or with different not-for-profit organisations, for example, would those be eligible if they fit all of the other criteria? So it could be working through social media or...
Yeah, we're not. The one thing about this, I mean, apart from the focus being very much, as I said, on low-income country community setting One Health, otherwise it's not prescriptive at all. In fact, we appreciate very much, as you all do, I'm sure, that innovation and wonderful solutions come often from completely left field. I think as long as it fits within the parameters of the study, then absolutely. I mean, I could foresee how different communication projects may well be possible. And really, we're looking for innovation in that field, and maybe integration, who knows. And the final stage is that we want things that will implement better policy and action. And action being, it doesn't have to be policy just per se, but action as well. So yes, I think if it falls within the parameters, that's great.
Great, thank you. There's a couple of questions around level of budget and timing, which I can answer now. So we've had a question around, we're looking for a 3-year budget, particularly when we're thinking about the very large grand prize and secondary prizes. It's important to be a time frame that makes sense. So we've had a couple of questions around, can it be less than 3 years in terms of budget? And I think it can, but in our experience to date with our other challenge, it's quite hard to spend that money effectively in a very short space of time. So just think through that really carefully when you're putting your budget together. Noel, if you've got anything to add to that, then please do jump in.
Yeah, I mean, I would also just encourage everyone to think about, when we're really talking about significant impact, most likely that is going to take time. And so, beyond that short term, let's say few months of a project that perhaps you're thinking about, how can that continue on? How can that, continue to create impact? And yeah, just really think about how to most effectively and create impact.
Yeah, thank you. Great answer. And Noel, we've had a couple of queries around assistance before the submission is made, and I know that's incredibly difficult. We get hundreds of applications, and certainly you do across all the different challenges that you support. What advice would you give to teams that may perhaps need a bit of mentoring or support on their application before it's submitted?
That's a great question. Obviously, it very much depends on the question that you are asking. As I dropped in earlier, we have that help@solve.mit.edu address. Please feel free to reach out with any questions that you have before the deadline. If it is something that we can help you with, we will absolutely do that. We do want to be careful, just for fairness sake. We're not going to give feedback on applications ahead of the deadline, but we can help you to think about, are you eligible? Sort through any technical issues, things like that. So when in doubt, feel free to email us and we'll let you know.
Great, thank you. We've had a few more questions around the different types of submission, the different stages of the proposal. So I wonder if we should go over that again. So if Hamish, you could just pop up that slide for us and we can run through it just to be really clear on the different types of stages that we'll accept for this challenge. Thank you. I think it's fair to say we're not looking for something that's completely brand new, that hasn't been tested at all. We do need to see some evidence of use. Marc, sorry, over to you.
No, I mean, I think that's, I think a number of questions we've had previously, and perhaps this is also in people's minds, is, how early can a proof of concept be? But as you'll see from this definition that we're using, you've got to have built preliminary evidence for the data, sorry. So this isn't just wow, I've got this great idea, maybe it'll work, maybe it won't. We're starting from scratch. That's not going to be eligible. A proof of concept you've got to have built preliminary evidence or data. And then, in terms of the pilot, I mean, I don't really need to read out what's in front of you on the screen. So, again, we're looking for these specific areas. I think where most people are asking the question, Louise, does tend to be around, can you put in an application for something that is just an idea or a hypothesis? And that, unfortunately, for this is not a place to apply. And you have to have built preliminary evidence.
Yep.
I think if you go to, I was just thinking as Noel was talking as well, it's not a bad idea to just have a look at our website and look at the winners from the last Trinity challenge, because it does give you a fair, there was a fair range of people from proof of concept. In fact, the second prize winner, for example, blood counts, was a proof of concept. And then there are scale projects in there as well. But also actually there's all four. So maybe go and have a look at those. They're very short, sort of 3 or 4 minute videos which explain the solution, and they'll give you an idea if you're still in doubt.
And maybe one additional thought is there may be solutions that have been really effective and used in other areas beyond antimicrobial resistance, where perhaps they're at growth or scale, and expanding that work into antimicrobial resistance is sort of a new initiative. In that case, it can be a little bit earlier stage, or the antimicrobial resistance effort can be a little bit earlier stage, as long as the sort of base solution that you're building from is further along.
Yeah, so it has preliminary evidence for it, but not in the exactly. And as said, sometimes there are people working out there outside of AMR that have fantastic potential solutions in proof of concept stage, but moving it over to AMR, absolutely agree with that, Noel.
Thank you. That's great. That's really helpful. I wonder if it's also something I can ask you, Marc. We've had a couple of questions around community data, and we can't describe all of that here today, but could you give us just a few examples of what that could look like?
So we're interested in antimicrobial resistance data. We're interested in antimicrobial use data. We're interested in access to antibiotics. We're interested in access to quality antibiotics, so quality assured, because of the problems with falsified and substandard antibiotics. At the same time, I mentioned the integration. So any or all of those could be integrated with maybe climate data, maybe mobility data. Let's say for mobility data during COVID, mobility data was used to track how people access diagnostics and vaccination and people's movements, and to look at transmission, and super spreading events. Climate could be anything. I mean, again, you could really pick most things. You could pick many examples. How does climate affect antibiotic access? About supply chains? About it's really sort of often thinking out of the box. But in terms of the pure antimicrobial resistance data sort of side, either be it in animals, in humans, how are antibiotics used? How are antibiotics accessed? We think we know that in some countries we would swear blind that antibiotics are not accessed, for example, in the communities without a prescription. Well, we know from a number of studies now using actors that actually, including in South Africa, that that's not the case. Are they getting it from a drug vendor? Where are farmers getting their antibiotics from? Access pathways. Again, as Louise, as you say, this is a really massive topic. But again, these model potential questions and sort of menu of opportunities on our website does actually talk to a number of these and give some example of community level data.
Yeah, and that's great. Thanks, Mark. And there may be an instance to combine hospital data with this community data for a particular project, but we're not looking for exclusively hospital data, or would that not be the case?
I think it's got to be very, very well argued if you're going to go down that track. We're really, really not focusing on hospital level data. If you can motivate and help the judges understand why hospital level data might be incorporated into this as part of your project, that's fine. But honestly, if your project and solution talks about antibiotic resistance in hospitalized patients and data coming out from hospitals, I'm afraid that's a non-starter.
Thank you. And perhaps we should move now to some questions around what happens if people are successful. So Noel, if I could ask you to talk us through what happens if someone gets shortlisted for this challenge.
Yeah, definitely. So if you are selected as a finalist, you will be notified. We'll let you know, and there will be some additional information that we'll request just to better understand your solution. So for example, we may ask about your budget and provide a template to provide a little bit more detailed information about how you would use the funding if you were selected. And there may be some additional questions that we come to you with that will better help the judges understand. After that, we will look to schedule a pitch interview day with the judging panel. So the idea is that there's only so much that you can share on paper, right? We also want to get to know each of the teams as people. And that's your opportunity to sort of show off your team. So we would work with you to find a time to pitch your solution to the judges. So typically a 3-minute pitch, an overview of the challenge you're addressing and how your solution would address it. And then the judges would have a chance to ask you questions that they have about your solution. As much as possible, we do try to work with finalists ahead of time if we have a sense of any questions that judges might ask. But otherwise, you would be on your own. And then once the pitch interview day is complete, the judges would have a deliberation and select the winners. And just recapping from what Marc shared earlier, winners would be announced in June, and actually the pitch interview day would be happening in early May, if I'm remembering right.
Fantastic. And perhaps, Marc, you could talk about some of the ways in which finalists and winners might be supported with the collaborators that we have at the challenge.
So we have a very broad range of collaborators from different fields, including digital technology. We have major companies. If you look at our inaugural challenge coalition, there was Facebook Health and Google Health and others. So there are digital technology companies. There are foundations, organizations that have specific interests, particularly in global health and in antimicrobial resistance. So it really is very much dependent on the type of application, the type of support you might need. So maybe that's data space, maybe that's mentorship in a specific, maybe in a digital technology part. Maybe it's mentorship more on the sort of clinical or scientific side. So we try and look at the applications and see where there's a synergy. It's not it's not an exclusion criteria if you don't have a partnership. In other words, it's not mandatory for a partnership to be made or a collaboration to be made. But there are clearly people within our coalition of members who are very interested in seeing solutions thrive, helping our winners to go further. And that's very important. So it will be obviously on a case-by-case basis, though.
Thank you. I think we've got through nearly every single question so far, and the ones that are very specific that need a bit more time for us to respond to, we've got those email addresses and we will respond to you today. So we'll get back to you as soon as we can. Is there anything left to say from Marc or Noel that you wish that someone had asked and they hadn't before we wrap up?
I don't think so. From my side, it's just, it's wonderful to see so many people on the webinar. It does, really show that there's interest, and that's on top of, what we're seeing on our website, which is fantastic. And I really encourage you, this is not like writing an NIH grant, or for those of you who do, or a very, very intense application. It is much more about the big picture, the big concepts. And really, as Noel mentioned, I'd really encourage you to think very carefully about what the most important aspects of each of these responses is, and put that up front, because so many of them only have 500 words or something. So it's a bit like, I guess it's the tweet for research applications. You've got to think about, condensing and using your words well. But I really encourage people to make their application. And innovation comes from the most wonderful places. And I'm sure your application will be very strong, and we're really looking forward to seeing it.
Yeah, just seconding everything Marc said. I'm really excited to see all of these applications just based on the questions that are coming through here today. There's so much wonderful expertise and different perspectives that you all are bringing to the table. So really excited to see how that sort of carries through to the solutions that you're applying with. And maybe just one more reminder and shout out to submit early. You can go back and edit your application. Please don't wait until the 11th hour to press submit.
Thank you. And thank you both so much for spending the time answering those questions today. And thanks to everyone that's logged in and engaged with us. It's brilliant. So that concludes our webinar. Please do follow us on social media to keep track of the challenge and its progress. You can also look at our website. This link on this slide that will be shared with you afterwards is the most important link. That is where you'll find everything that you need to know, everything we've covered today, and more information, and the application form. So please do take a look and get those in on time, as Noel said. If you need any help, please email. There's help@solve.mit.edu and info@thetrinitychallenge.org. Please use that opportunity to ask your final questions or ask for support if something doesn't quite work for you in the portal. We'll send you a short survey. Please do fill that in. It really helps us with our work and how we organise these events in the future. And you can follow us on all the different social channels. It's been a pleasure being with you this afternoon. final thank you to all of you for attending and to our funders for making this challenge possible. And we can't wait to read your applications. So good luck to everyone and goodbye for now.